Okay, good afternoon, everyone. I'm Dr. Azra Khan, Assistant Professor in Noida International University in the Department of Public Health. So, as you all know, today is World AIDS Day. And in Noida International University, we went for community visits and all today. And it was really nice. So, just an hour back, we came back, and I got to know that I have to give a presentation also here. So, in HIV, what is the basic prevention? And we need to discuss prevention and breaking the stigmas. That means I'll let you know a little bit of comprehensive guide of understanding prevention. What are the basic preventions, and how to support those people, those who are affected. Okay. So, first of all, I would like to make you understand that I think HIV, the basic thing everybody knows. So, it is actually human immunodeficiency virus, which is a virus that is attacked. That is a virus that attacks the body immune system, specifically the CD4 cells. What is CD4 cell? CD4 cell is actually the manager of cells, which it's actually called T4 cells. Okay. So what happens in this, the total blood count is actually 1500, but when a person is affected with HIV, it reduces to 200. Okay. So I'll be clearing this you in the next slides. So if anyone is left untreated, so the HIV can leads to AIDS, and the most severe phase of HIV infection with proper medication care, HIV can be controlled, and people with HIV, they can live longer and with a healthy lives. Now, first of all, we need to understand what I told you before. The CD4 cells, that it actually drops to 200 cell per mm. That means that the virus has entered more, and the susceptibility has reached to the point that the immune system of a person is totally destroyed. Okay, so that means a person who's having an AIDS. What needs to do is, without treatment, it is not possible. Okay, so the people with AIDS typically survive around 3 years. So let us understand what are the basic global impacts. Approximately 39 million people worldwide are living with HIV. Now, only 40 million people have died from AIDS-related illness since the start of the epidemic. Related to this, sub-Saharan African countries carries the highest burden of AIDS disease. Why? Because the awareness is very less. You can say the medication is very less. WHO and UNICEF, they're reaching out there. They're working on the many AIDS program, AIDS wellness programs, but yet it's not been very, up to their mark. And people are like living more of, I would say, a kind of nomad's life. I mean, there are some remote areas where the medication is still not reached, and people are living with AIDS even if they don't know. So the progress has been made, but there is a challenge. The challenges are still remaining, and people has to address with that. Now, if we understand like how HIV is transmitted, so we basically know that unprotected sexual contacts with an infected person is causing for HIV. Number two is sharing needles or syringe with someone who is already having HIV. Number three is from mother to child during pregnancy or birth or during breastfeeding phases. Okay. Now, the blood transfusion is also one of the biggest sources, which is almost in the rare in the countries with the screening. But I would say most of the time, where the population is big and sometimes the transfusion, some checkups are missing, the AIDS, the HIV virus comes with the transfusions also. So earlier, this was the case, but nowadays the thing has been little enhanced. But still, I would say the sub-Saharan countries and The countries which is having still in the developing phase or very low sub-Saharan countries are having this type of problems. Now, coming to the needle stick injury, I would say occupational exposure. What is occupational exposure? You would understand like the people who are the healthcare professionals, those who are sitting with or working with the nurses, the paramedicals. Sometimes what happens, it is pricked by instance. I mean, this is by accident, and there is some blood, and we don't know that it is going to infect. So the needle stick injury is also making can make a big problem to to transmit diseases like HIV. How HIV is not transmitted. So the basic thing, we are educated, but some people like the rural areas people, if you ask them, so they're not very well aware. So we need to make them understand also that the casual contacts like hug, kissing, or shaking hands do not cause HIV. If you share food or utensils or any kind of drink, it is not transmitted. Number three, using the same toilets or the swimming pool or the gym equipment will not transmit your disease. Number four is mosquito or other insect bite. Yes, though mosquito are the carriers of the blood, but they do not transmit HIV. Now, the last one is saliva, sweat, or tears. Unless it is mixed with blood, it is not transmitted. So remember, HIV cannot survive long outside the human body. So if it is from the mosquito, so nobody is going to transmit diseases from that. Now, coming to the stages of HIV infections. Number one stage is acute HIV infection. What do you understand by acute HIV infections? It is the basic initial days of HIV, like 2 to 4 weeks after infection, a person gets a normal flu-like symptoms. So the acute HIV infection with the basics is what happens in 2 to 3 weeks of initially the person get infected. There's a flu-like symptoms, yeah, and then it will go to heavy contagious infections. Now the second stage is chronic HIV infection. That is of course asymptomatic or sometime a mild symptoms it will have that can last for a decade or longer. What I mean is decade is sometime a person doesn't know that he's carrying an infection of HIV, and it's almost 10 years, 12 years, 8 or 9 years, 10 years, 12 years, and then he gets to know that he is having an HIV, and he is still passing, infection. So most of the time this is asymptomatic. The person doesn't know that there is no symptoms. The person cannot understand what the symptom is exactly. So and sometime he got married, so he is now having a sexual contact and the wife is getting infection. I remember I think 3 months back it was a news that there was a girl, I think in Noida only. She was a kind of what you say, the red area girls, and that girl alone has infected 39 to 40 men, 39 to 40 men with HIV. And when it come into limelight, the whole case was like the people, they got like crazy, like how this happened. And then after multiple research, after multiple inquiry, it came to know that the girl they had with sexual contact, these all men got this infection. So people are so for very long they do not understand like wow how the thing is going on, and once they get to understand the situation is critical, now they cannot come outside of it. So most of the time it's going to be very contagious, but the person is totally unaware until and unless the symptom is showing like this is too much weakness or the diseases are attacking one by one, and then a person goes to check up and comes to know that there is so much of diseases, and then the last checkup is being done is called AIDS, and then the person find out, yes, now there is nothing left, and there is already 10 to 15 years past. Immunity is so low that it cannot rise up. But nowadays, I mean, this year, there is many vaccinations coming, and which is going to be very effective. Now, we are discussing for the AIDS stage 3. That is what I told you is severely damaged in immune system. That is the infection has almost killed the person, and totally the immune system is destroyed, and there is no life. Just a person has to understand that this is the last time is going off of my life. So that's the severe damaged immune system the person is living with. Now, coming to the symptoms to watch for in early stage, what a person should watch for if he is having a little symptom is a mild fever, there will be a fatigue, there will be a swollen lymph nodes, there can be a sore throat or the rashes. But in the advanced stage will be a rapid weight loss. The rapid weight loss, a person has to understand that why there is a rapid weight loss. And the recurring fever, the fever was there and it's coming again and again. The prolonged swelling in the body, the chronic diarrhea, sometimes the pneumonia. These are the advanced stages. A person has to be very careful. Now, coming to the prevention and safe sex practices, using condoms correctly every time, limit the number of sexual partners. This is going to be very important because the person doesn't know that who is having this disease and whom he is transferring. Most of the people, like I would say the high class people, the doctor or professors are okay. But what about the drivers? What about the people who are sitting in the dhabas or the small restaurants, the roadside restaurants? These people are more prone to the diseases because they do not know how to limit their sexual partners. Okay, now getting tested regularly and know your partner status. Again, this is I would say this is a high class thing, but the person who is of a very low level or a layman man, he's not gonna test unless and until the critical problem is there so much. The problem is like if he's thinking like the situation is getting worse, or the body is not responding well, or he's getting a severe infection every time, so then he will be going for a test regularly. Now, coming to avoid alcohol and the impaired judgment, that means that, of course, alcohol and druggist people are more prone to get this type of HIV. Why? Because once the person is alcoholic and he's a regular drinker, he doesn't know what he's doing. So it impairs the brain of a person, right? So he doesn't know the person who's taking drug and he's not in the senses. He doesn't know which girl or which boy he is going. So he's out of his mind. So a person does that, and then later he comes to know that the person is living with HIV for so many years. So these are the trigger things like alcohol and drugs. Okay. Now, now consider a pre-EP
佢哋有冇
if you are
睇住啊？
high
佢哋
risk. That means the pre-exposure
佢中毒啊！中毒
prophylaxis. That means the daily medication can reduce the risk of getting an HIV from sex about 99% when taken as prescribed. So, who should be considering pre-exposure prophylaxis? The person who will be who is the positive partner. This is one. People who are living with HIV positive partner. Number two will be the people who are not using regularly condoms. The third is who injects drugs. The last is anyone who is a substantial at risk. Let me focus again on the injecting on of the drugs, because I would not say the people who are taking drugs nowadays, the university students, the college students, the students, big institutions, big universities are also coming up with these kinds of this kind of problem, like who are taking drug with for the pleasure and all, and then they come in the contact with the girl or the boy, and that happens, and later they realize. And of course, anyone who is at substantial risk it's also going to be very prone of this kind of infections. Now, the emergency medication, when it happens, let's assume it's post-exposure prophylaxis. So let me tell you, the emergency medication, when a person feels like he or she's been already exposed to. So what he can do is he can take emergency medication taken within 72 hours after possible HIV exposure. That must be started within 72 hours, or ideally with 24 hours. Now, taken daily for 28 days, and then can prevent HIV infection after exposure, and available at emergency rooms and clinic. A person should visit that, yes, I've been exposed to this, and now what I have to do. So this quick things can be done once a person knows that I'm already exposed to it. Now, prevention for the people who inject drug. This is very important. Never share needles, any kind of syringe, any kind of drug equipment. Number two is using of needle exchange program for sterile equipment. Number three is considering medication assisted treatment for substance use. Medication assisted treatment means whenever a person is in contact with substance use things like drug, alcohols, and like this, so there is always a need of medication. So without medication, if a person goes, so that's not the right thing he is doing or she is doing, and try to medicate himself or itself by whatever they think it is good or bad. Or nowadays there's a Google, so you just need to check it, and the people are working on Google, and they are trying to get medication by their own. So that's going to be very dangerous. So the another thing is get tested regularly with HIV and hepatitis also. Use of PrEP if that is at high risk. Now, the prevention to mother to child transmission. With proper treatment, the risk can be reduced to less than 1%, of course. The prenatal care and testing during pregnancy is very important. I think nowadays in India, in every pregnancy, the doctor does that. The AIDS test, the HIV test is done. Now coming to antiretroviral therapy, that's called ART. ART during pregnancy is also important. Medication during labor and delivery. So ART for the babies after birth can also be given, and avoid breastfeeding in the areas where there is a safe alternative exist. The importance of testing, why we need to understand what is the need of important, what's the importance of testing HIV is everyone which is having the age of 16 to 60, 13 to 64 should get tested at least one time for HIV. The early detection allows for early treatment, of course, and protects partners by preventing transmissions. Now, the peace of mind is reduced, and there's a peace of mind, and the anxiety is reduced to some level, because if a person goes and he's feel like, okay, there is nothing in my report and I'm feeling okay, so there is a peace of mind, of course. And the testing, the testing should be confidential, and most of the time this is free in government hospitals. Now, The type of HIV test, let me tell you, the antibody test that detects the antibody in the blood or the oral fluid. There is an antigen or antibody test, detects HIV antibody or antigen after 18 to 45 days after infection. But a person has to remember that he did something, he took drugs during a loss of mind, during the sexual transmitted disease, during maybe he used some kind of needles. And then NAT test that is done for 10 to 33 days after infection. Now, the people living with HIV, and they need to get a treatment also. So the ART is the treatment for HIV. This is number one. Number two is the combination of HIV medication has to taken every day. Number two is it reduces viral loads to undetectable levels. Number three is it allows the immune system to recover slowly. The another thing is it prevents the progression of HIV. Of course, when there's a control in immune system to recover, there will be a progression, of course, for AIDS. Okay, to prevent there will be a progression in preventing. Now, what is undetectable or untransmittable? The U means the game changer. When a person is living with HIV and he's taking ART as prescribed and maintains an undetectable viral load, so they cannot have sexually transmitted, HIV. And this scientific breakthrough has it has made a more revolution on HIV prevention and to reduce stigmas as well. Now, understanding the stigma related to HIV is stigma refers to the negative attitudes. What exactly stigma means? The person has something in his brain which is from very long, the belief system, the attitude, or any kind of attitude which is negative. So anyone can have this type of stigma. It doesn't mean that the person should be he's not educated at all. He can be a midman. He can be he can be a businessman. People can be rich or poor. It doesn't matter. But there is a stigma behind that. So number one stigma, which is the basic of any problem, is the fear and misinformation. When I say fear, that means a person don't want to ask and don't want to understand, don't want to learn about things, what HIV is, and he has a lot of fear, a lot of stigmas. And if he gets the information, mostly it is misinformed. So there are two deadly combination. One, a person is having a fear, and another is if a person is getting misinformation. And not even in the AIDS thing, anywhere, if you are misinformed, it's going to lead you astray. So the biggest problem is the misinformation and how it is carried. This is the most important thing to understand and to break this. The second is moral judgment about anyone's behavior. So a person, maybe let's say a person is having HIV, and another person is starting judging it and about the behavior, about the person, about the thing. So of course he's afraid and cannot talk to you. He cannot understand you. So there can be a moral judgment. So he's afraid to tell anyone. Number three is discrimination and social exclusion. Of course, he will be socially excluded if a person, if you get to know a person who is having HIV in your relatives or in a far more relatives. So most of the time you like to just hide it. But once, if he's getting, if anyone gets to know that this person is having HIV, there will be a social boycott. Nobody's going to help him out. Nobody's going to make him understand. Nobody's going to love and care for him. Nobody is going to help him by the money or by any kind of assistance. Rather, there will be too much discrimination done. The another thing is internalized shame and self-stigma that I was discussing about. The shame is there because nobody's going to ask, did you get this HIV from the needle, or you had unsafe sexual practices? Nobody's going to ask you that did you had some drug? So that there's so much of self stigma inside, and self shame is also there. So the people
I
living
got to
with
see
HIV, mostly
got to
they do
see
not
and
tell
told them
anyone. They are living within
she can
themselves.
go
They do
this
not
time.
want
Yeah.
to talk for anyone with anyone, and they're the hidden people most of the time. So this stigma it needs to be this is to be a break, and one of the biggest barrier to HIV prevention, testing, and treatment is of course this stigma, because people are afraid. They do not want to get to the treatment because he cannot go alone. Somebody has to be with him or her, and then there are a lot of people. There can be a lot of talk. So there is a lot of shame to understand or to tell to the doctors or to the family. So this is going to be a biggest barrier out of it, right? Now, coming to the impact of stigmas, of course, that there is a delay in testing. A person who gets to know that he is having HIV, so he do not want to go to doctor. He's having shame. He needs to understand first. I mean, it maybe it can go 2 months, 3 months, 4 months, and he's in depression. He do not want to talk to anyone. So there is a delay in testing and diagnosis also. Now, coming to the poor treatment and adherence due to the fear of disclosure, as I told you, a person who is living with HIV do not want to disclose that what is the level of my HIV and how I got this disease. And of course, this is a matter of shame, and how this is impacting to one individual, right? So there's a mental health issues also. A person who is not going for testing, he's not disclosing anything, then there is a depression also, there's an anxiety also, the kind of isolations. The isolations is like he's just dying inside, but he cannot tell a person that let's go for testing. Maybe there can be a mistake I did, and this is the problem. So there can be a discrimination in healthcare or employment or housing. Of course, if he's employed anywhere and the person or the office staff gets to know that this guy or this girl is having HIV, so of course this a lot of discrimination is going to happen, right? Now, another thing is the reduced quality of life and social support is going to be very obvious, of course. The quality of life is very much reduced, and the social support is reduced. This is the thing when a person gets to know that a person is suffering from HIV. So the quality of life is, of course, reduced, and the people are not supporting that. It's a kind of totally boycott. Okay, that's kind of totally boycott. Now, um, increase HIV transmission due to lack of awareness. This is of course, a common thing. Now, the myths and the facts has to be known. The myths is HIV is like a death sentence, I would say, because HIV person can live long and live healthy. So if a person thinks that this is like a death sentence, so this is a myth. Okay. The fact is, with the treatment, with the people, a HIV person can live a healthy life and enjoy, but with the regular treatments. Another myth is you can tell someone that HIV is by looking at them. So HIV has no visible symptoms in many cases. So testing is only the way to know. Another myth is HIV only affects a certain groups. But the fact is, anyone can get HIV regardless of age, gender, race, sexual orientation. More myths and facts, you can say you can get HIV from casual contacts. So the fact is, HIV is not transmitted through hugging, kissing, or sharing utensils. Myth is again, HIV positive people shouldn't have children. So the fact is, With the treatment, the risk of mother to child transmission is less than 1%. Again, that means with treatment, the problem can be reduced to 1%. Another myth is HIV treatment is too expensive, but the fact is many programs provides free or low cost HIV treatments and care. Now, breaking the stigma and education is learn the facts about HIV transmission and prevention. Understand you, that means to share the knowledge, challenges, and misconceptions. Whenever you hear them, you need to talk about, you need to educate yourself, you need to educate others. You need to have a correct language that who is HIV victim and who is not. So you need to share also accurate information on social media. This is also very necessary. Now, breaking the stigma, that's empathy. Listen without judgment to those affected with HIV. This is a bad thing. I mean, a person should not judge anyone. Rather, he should offer support and uh, thinking that there can be any fear or any kind of problem. Rather than this, a person should support. And then he should also respect the privacy and confidentiality. This is the most important thing, that if a person shares you something, even for the disease, any kind of disease, not even AIDS, you need to be very private and confidential. And the next thing is that treat everyone with dignity. I mean, regardless of HIV status, if the person is having HIV or not, there should be a dignity maintained, and you have to treat everyone with dignity. And the last is to remember is HIV is a medical condition. It's not a moral failing. It's not a moral failure. So it's totally a medical condition. It can be treated, of course. Now things comes to advocacy. Support organization working on HIV issues. And to participate in awareness campaigns, you need to, or anyone and who is in organizations, anyone who is in small or big organizations, health education sector, schools, colleges, they need to make an awareness campaign on World AIDS Day. That's 1st of December today, and to advocate or to need the change in policy that protect the rights of HIV people. This is very important, that there should be some rights for these people, and there should be no discrimination in the workplace or healthcare practices. And people should amplify voices, people living with HIV. So they need to raise their voice and to, help them out on this. Now, supporting someone with HIV is uh, educate yourself about HIV and treatment, and be there to listen them without judgment. Respect their privacy. Do not share their any kind of status, and continue to having a normal activities though. Then a person should have encouraged treatment adherence. Healthcare without stigma, if we talk about, then the providers play a crucial role in reducing stigmas. That is, they provide a non-judgmental and confidential care. This is very important. The use of respectful language and communication. This is very important. Ensure privacy during consultation. Offers comprehensive services without discrimination, and trained staff should be there for HIV sensitivity and competence. So the healthcare providers have their very crucial role, but these has to be followed to reduce the stigmas. So what are the legal protection if we talk about in many countries? In many countries, they have a law protecting people living with HIV. Now, the first is protection from employment discrimination. So there is no discrimination in whether they are working, and they're not treated as the person who is having HIV. Now, protecting from household discrimination, healthcare access rights, privacy protection rights, equal treatments in public accommodations, So these are the legal protections in many countries. You need to check out for the developing and sub-Saharan African countries, what are the legal rights for the people who are suffering from HIV. Now, coming to the path of ending HIV is UNAID 95 targeted by 2030. That means 95% people living with HIV know their status. And the 95% of those diagnosed received treatment, and 95% on those on treatment have viral suppressions. This is the United Nations AIDS program targeted by 2030. So achieving these goals require ending stigma and discrimination. I mean, this is very good. United Nations AIDS Control Board has made such a target for 2030. So the reduction by 95% can only be done if there is a less of stigma. The stigmas are lesser, and there is a less discrimination, and there is more of awareness programs happening, and more of YouTube channels, or the social media is also helping them out on this. Now, take action today is get tested and know your status first. If anyone who is feeling to have such kind of symptoms, now practice safe sex and discuss HIV with partner. And the third is educate yourself and others about HIV prevention. Challenges the stigma whenever you encounter it, support people, and advocate for their resources and policy changes. So we are not basically the policy makers, but the people who are in the policy making should have the changing policy according to the situations. Now, the last is together we can end HIV. That means prevention plus treatment plus ending stigma. That is an AIDS-free generation. So every action counts, every voice matters. Every person deserves dignity, respect, and quality healthcare. So let's end HIV and AIDS together. Thank you, everyone.
Such an informative talk. Thank you, Dr. Azra Khan, for the insightful presentation and valuable inputs. Now, I invite Dr. Abbas Kazim, Consultant NCDC, Ministry of Health and Family Welfare, to start with his session. Please go on, Doctor.
Just give me a second. So, good afternoon, everyone. So, is the slide visible?
Yes, Doctor. It is visible.
All right, all right. So, Dr. Azra Madam and Dr. Haricharan sir has already, told much about the HIV and related to its the challenges and the future directions and too much of it. And I think it has made a base about the future slides, which I'm going to present about digital disruption, the AI and the telehealth in the AIDS response. So, as we have already gone through that, the epidemic burden of the HIV is too much in a country like India, where India bears the third largest HIV epidemic, and with an estimated 2.5 million people living with HIV. Though the adult prevalence, stands at 0.20%, the gap there is that only 79% of the PLHIV know their status. So here we are still missing the 21%, and which is we are far away from the 95 targets. uh, Another thing is, the positivity yield as the targeted intervention sites, they have also dropped to 0.29%. So, which is again a low. And you see, we are talking about a country where still 25.44 people are living with HIV in 2024. If you see the last report published by the NACO, which was in December 2024, and which also mentioned that 44% of them being women, right? So it's means a lot that we need to work too much to remove this pandemic and achieve the 95 goals. Apart from that, there is a constant need of reinforcing the AIDS program, so that the PLHEVs may also become aware of the status at the earliest. They start taking the ART, and also we want the viral load to be suppressed. So, you see, the condition is worse in Northeast, where we see a prevalence of more than 1% in states like Mizoram and Nagaland. And these are the states which have the highest number of the identified districts where the NACO is focusing more on this HIV. And apart from that, if you see the Manipur, we see 0.87 prevalence is also close to 0.87 in Manipur, and also the states like Andhra Pradesh, Karnataka, Meghalaya, Punjab, and Telangana. They also have the prevalence which lies in between 0.40 to 1% rate, and certain trends were rising, and this was seen in Punjab and northeastern states, and whereas the Nagaland and Manipur were the high prevalence therein. So our main challenge is that the traditional physical outreach has hit a saturation point, and we need a new radar. So today in this workshop, I'll be talking more about what digital interventions has been done, and how they have what is their reach and how they have tackled those challenges. So one of that intervention, it was called Yes for Me, and this intervention was launched in 2018 in the state of Maharashtra, where initially they have taken 3 districts, and in the next year they have quickly scaled to 15 districts, including the Lucknow, Kanpur, Chennai, and Hyderabad. It was a good example of PPP, public-private partnership, which Dr. Haricharan sir already stated that it is a need, where it was a collaborative effort of the USAID, PEPFAR, FHI 360, and the NACO. So I'll tell you more about how and what was the digital mechanism in this project, and how the reach was made, and what activities have been done, and what are the results of that. So there were four basic digital mechanisms. One was the outreach. So in the outreach, instead of doing it physical outreach, these are targeted advertisements on social media and applications which are more used by the key population. So these apps were Grinder, Romeo, Planet Romeo, and apps like Blued. So these apps usually the population from the key population dating app, and these apps were targeted advertisements have been done. And after the targeted advertisement, these the interested clients, they comes to our landing page, where there is an assessment, which is a 5 questionnaire risk questions, where they will get some vulnerability score. So once they answer the questions, they will get some vulnerability score, how vulnerable they are to getting the HIV infection. So after they get the vulnerability score, they can book services for the HIV testing. And these we have all, as we have linked with NACO, we have all the government's labs under the NACO, as well as 56 plus subsidized private centers also, which were doing it for subsidized rate. Once all these things have been done within the app, we have a option where they can show the report for a post test also, for counseling with a medical doctor, and it will more like a teleconsultation. Apart from that, even before booking the test, if they want to speak to a doctor about their exposure, how the risk was there, and why they are fearing so much, or any kind of stigma or anything related to that, they can have a pre-test consultation video also. So pre-test and post follow-up calls was the next step of the care. Apart from that, in case any of the person coming to the portal comes positive, we try to do further connect with the PEP or PrEP provider, as well as the ICTC or ART center, whatever is needed. And apart from that, if in case ART or the PrEP is needed, we also have tie-ups with the certain pharmaceutical companies which can just do an home-to-home delivery of these medication at a subsidized cost. So its impact was we have completed about 20,000 risk assessments, and 1,098 individuals tested via this virtual linkage. So as we have seen in the previous slide, the physical outreach, the positivity yield was near to 0.29%. Now with this virtual outreach, the positivity was coming around 5.5%. Apart from that, we have also reached 27% of those population which were first time testers. And they revealed that 78% of them have never used condoms. So we do a lot of awareness sessions and counseling also for that. And 44% has reported multiple sexual partners. Now we want to do a lot of other innovations within the project. So we made a grant which was called Rethink HIV Challenge, and this was also launched, which attracted around 64 applications, and 3 innovations were piloted and they have been given the grant. So one was Jubi.ai, where it was an AI driven chatbot where you can ask anything about related to HIV and AIDS infection. We It was majorly to promote the HIV awareness and answers quickly, very instantly. Apart from that, there was one other digital innovation, which was One Key Care. One Key Care, what it does, it use kind of gamification strategies on the unreached populations on these apps. So we have the apps I talk about, the Grinder, the Bluewood, and the you know Romeo app. And these app, they do gamification techniques, and with these techniques we do active engagements with these key population. The third was Twistle, where Twistle created a personalized and automated pathways to nudge the behavior change and promote the ART adherence. But talking about telehealth, there was one challenge which we faced where, the newly initiated PLHIV, there we saw a 30% dropout rate. So it was challenging for us. So we created a solution, and in this solution, always tell the patient to, whenever they take the medication, they call a toll-free number. So it is just like a missed call, just to verify that they have taken the medication. And once the missed call is there, it triggers an automatic response that after how many days he will get a trigger SMS reminders, and also about the for the so more about the adherence perspective. And apart from that, it resulted in 1,800 enrolled participants, and adherence rates have significantly improved to 80%. Then we wanted to bridge the gap. And once about the peer navigators. So peer navigators usually guide the key population linked with HIV through physical treatment system. And this virtual approach of the of the peer navigators has also been adapted lately into the national guideline by the NACO, and where 2,400 key population living with HIV were supported directly by the peer navigators, and 98% were also linked to the ART treatment. And another thing which we found was very effective was the index texting. So in the index texting, whenever patient come positive, I wanted to test their partners and all that. In that thing, we have make it into a incentivized process. So if you refer a person for an index testing, you will get certain incentives. So initially, it contributed to 20% of our findings, and by the project's end, 45% of the new diagnosis came through the index testing. So this proves the efficacy of such network based case finding. uh, yes. So how we differentiated the prevention services? So we understand that one size, fits all does not, is not the right approach, and it can be done when we talk about key population. So we implemented a segmentation tool. In this risk segmentation tool, there was four, processes. One was the active risk, the new registered ones, and the maintenance, and the stable ones. So high priority is given for the immediate intervention is given for those who are found in the active risk in the risk segmented tool, and those who are the newly registered, the first time registered, we focus more on the educational or the initial linkages or establishing the trust with the patient. Apart from that, the maintenance and the self-management with periodic digital monitoring, as we talked laterally. So this model was standardized, and this was also scaled up by the NACO to 88 TIs. And the way forward is that, yes, for me, index SC models, these are good, case studies or the best practices which show us the how digital tools like self-assessment, AI, and telemedicine, these can be formally adapted in the other programs as well, and for the other diseases as well. So NACO formally adapted this program, and any CP5 strategy document, they also call for such sustainable models. So we are moving forward to achieving the 95, 95, 95 goals. But I believe the this if unless the digital divide, we overcome the digital divide, and we work with the PPP models with the private partners, as well as in these key populations and hidden populations, we will achieve our goal. So these are certain references from where we have taken these slides. Thank you.
That was great, Dr. Abbas Kazim, with good insights and with good stats as well. Thank you very much.
Thank you. Thank you.
We'll move on to the next session with Dr. Abhishek, consultant and scientist, Department of Ops and Gynae, VMMC, and Safdarganj Hospital. Safdarjung Hospital. Please go ahead, Dr. Abhishek.
Yeah, thank you so much. My slides are visible?
Yeah, doctor.
Yeah, thank you. Good afternoon, everyone. So myself, Dr. Abhishek. I am working at Consultant Safdarjung Hospital. So thank you so much, Delhi Medical Healthcare Academy, to giving me the opportunity. And we see today's occasion of World Health AIDS Day. Is honored to join you on a meaningful day where the global community comes together with one voice to reflect, remember, and to recommit to the ending HIV as a public health threat. So, so today I'm covering these outlines. So already my colleagues covered the topics. So towards I'm taking the more pregnancy, maternal child health, and mother to child transmission. So you can see the importance of the education about HIV is widespread and accurate. And there are lots of discrimination based on HIV status is history. Everyone is aware of the HIV status. And the future is filled with hopes and acceptance. And the narrative is changed from ignorance to awareness. So everyone knows this is the theme of WHO, overcoming description transmitting to the AIDS response. So in 2024, there are estimated 40.8 million people were living with HIV globally, and approximately 6 lakhs 30,000 people died from HIV related cause in 2024, and estimated 1.3 million people acquired HIV in 2024. So there are still the more cases in India overall worldwide as well. So coming to the burden of the HIV among women in India. So before that, I'm covering today's in the topic. So before pregnancy, during antenatal care, at delivery, and postpartum period. So in the postpartum period, I'm covering the after 6 to 8 years after birth, how women and child suffering from HIV, what are the issues. So I will be covering. So coming to the burden of HIV among women in India. So most of the we can see in India, women of reproductive age group continues to the significant proportions. So we can see the of HIV affected populations more towards adolescents and reproductive age groups, and contributing nearly 40% of people living with HIV in India. So where the national HIV prevalence has declined overall, there are the declines has not been equally across all groups, but women, especially those are reproductive age, there are more. So remain highly weakness. So in that there are more adolescents, girls and young women, pregnant women, and migrant and displaced women. So impact of descriptions. So reduces the HIV testing and ANC visits and antiretroviral therapy, that is ART interpretations, and increasing stigma and delayed care. So we see that there are lots of threats in HIV can evolve into AIDS. Weakness is the immune system is not curable, but there are lots of the treatment ongoing. There are vaccination now, so we can discuss in more how the modes of transmission and protective sex, HIV infected person to person. After that, blood or blood products and sharing of needles contaminated of HIV. These are the modes of transmissions. So prevalence as of 2030, the adult of HIV prevalence in India is 0.2% with over 2.5 million people living with HIV. There are new infections where you can see the estimated, this is the map of India. You can see the everywhere there are lots of cases towards north, south, east, and in the most of the new infection cases established annually, new HIV infections are around 66,400, marking a 44% decrease since 2010. So there are tests. India conducts more than 30 million free HIV tests annually and offering comprehensive tests to all pregnant women. And coming to the treatment part, over 1.7 million people receiving from antiviral therapy through public health systems in India. So HIV care continue to for women. So we can see there are the preconceptions, preconception. Sorry, the preconceptions windows is missed when the opportunity in many settings and routine HIV screening during pre-marital or pre-pregnancies, counseling allow early detections, and counseling should be focuses on contraceptions, safer sexual practices. After that, prophylaxis awareness and myth and stigma early we need to see. So on coming to the second B, pregnancy. When pregnancy, during pregnancy, universal HIV testing in all trimester is essential. So after pregnancy in first trimester, second trimester, third trimester, after postmortem, after delivery also needed, because as seroconversion may occur later in pregnancy also. So all HIV positive pregnant women must be linked with immediate to ART to achieve viral suppression. After that, they integrate the HIV services into routine antenatal care, ensure that the HIV testing, counseling, and ART follow-up become part of the standard maternal health visits. And after that, we can see the monitor and maternal viral load. These are the goals when we can see the life from HIV continuum care is HIV first diagnosis. After that, we need to see the find a healthcare provider, start HIV treatment, and after that, take your health medicine every day. See the healthcare providers regularly. Take care of your physical and mental health. That is, this is the goal of keep your viral load undetectable. Now coming to the intrapartum and delivery. So here we can see the this stage requires careful planning. When we do the mode of deliver is based on maternal viral load and obstetric indications. So in that we have to see the strict infection prevention protocols. After that, ensuring ART adherence, and we need to see the preparing the facility to manage HIV positive deliveries are essential for minimizing the transmissions of post deliveries and during deliveries. And we have to see the postpartum care when we need to see the breastfeeding counseling, exclusion and maternal ART. After that, supportive exclusion, breastfeeding while maintaining the strict maternal ART adherence, and infants must be receive prophylaxis and early infant diagnosis at least 6 weeks, And after that, we need to see the plan follow visits and community support to workers tracking and peer support strengthening. Have to see their retention and care. So we can see the HIV care continuum. So we already I discussed in previous slide the steps that people with HIV take care from the diagnosis to achieving the maintaining the virus suppressions. So major gaps in HIV care for women, delayed in diagnosis. When we see the missed testing and opportunities, we have to see that many women get tested only during pregnancy or not at all. Sometimes missed their opportunities during the preconception. So they have to see the in family planning visits. After that, early pregnancy can lead to late diagnosis, which increases the risk to mother to child transmission. So after that, we need to see the limited preconceptions counseling. So here we have to see still not routine. There are many parts of India as a part of opportunities to screen women before pregnancy. After that, need to discuss with contraception, safe sex, and after that, stigma and fear of disclosure. So coming to the description due to pandemic or resource shortage in COVID, we can see there are lots of weakness system can be done during crisis. We see the reduces HIV testing, fewer antenatal care visits, ART stockouts, and limited access of facilities. This directly increases the risk of transmissions. And coming to the weak linkage between ANC and HIV program, where there are modes of issues are the shortage of ANC coverage, integration with HIV service to often inconsistency. After that, high postpartum loss to follow because due to after delivery, people take the discharge and they unable to trace or unable to track them. So again, there is a lots of issue in spreading the chances of more chances of the HIV and low awareness of prophylaxis among at-risk of women. So there are lots of barriers of HIV care. There's stigma after the shock during HIV diagnosis, lack of social programming and fever. We can see the discriminations, lack of awareness, and after that, untreatable. They think there are loss of lack of stabilities. These are the issues still we are facing. So how description affects the area when we see, then we can see the reduce the HIV testing in ANC test. So in that we can see that interpreted ART supply and delayed refills and reduce the outreach due to fewer fields workers, limited facility to assess crisis, psychological and financial stress, and high risk of mother to child transmission disease. So when there are lots of barriers when we need to see how we can solve these are the issues, and while child and pregnant women are in the high cases. So transforming the AIDS response in women's. So we can see the key strategies: strengthening the prevention of mother to child, universal HIV screening in the first trimester, ANC, second trimester, third trimester delivery. We need to see ensure the uninterrupted ART supply, and we have to see the digital reminders for visits and other runs. And after that, how the HIV service we can give them ANC plus HIV testing and counseling, how we can give them preconception counseling modules, and community-based intervention. ASHA and AM can lead their house-to-house home follow-up tracking to see the peer support and mental health support and telemedicine and mobile reminders to take them medicine. We have to give these key strategies and strengthening the AIDS response. So after that, these are the publications where rethink, rebuild, and rise the HIV related issues, how we can prevent them the HIVs. And coming to the reducing the stigma, sensitize the healthcare workers, give them couple counseling, after that safe space and support programs. Stigma is very important. Mental health support is very much important in the HIV and AIDS. And innovation transmitting care. When point of care viral load testing important. Prophylaxis for high risk women is very important. Long acting injectable ART and therapy is important. And after that, digital adherence tools. Here we need to see their high activity HIV prevention, behavioral changes, treatment of antiretroviral. After that, social justice and human rights, biomedical strategies need to think their highly active HIV preventions. And coming to the outcome of improved continuum of care, here mother to child is less than 2%, better maternal viral load suppressions, improved maternal mortality, improved maternal and neonatal outcomes, and empowered families and communities. So here we need to think about the reflecting to how we can the care early interventions, how outpatient service we can give them intensive outpatient service, partially hospitalization service, house to house service. After that, we can medically manage the intensive inpatient services and clinically manage the highly intensive residential services. So coming to the main important conclusion part here, in the gynae, usually bridging gap across the entire continuum of care from the preconceptions to pregnancy, delivery, after delivery, that is postpartum, and encourage uninterrupted woman-centered HIV service, we can truly transform the AIDS response. And mainly important part is the woman at the heart of prevention, treatment, and community resilience, strengthening their cases to timely access to the timely testing and ART, respectively care. And we need to mentally support the system will not only reduce the infection but also improve the maternal and child health outcomes across the generations. And main collaboration, innovations, and commitment from healthcare workers, policy makers, and community partners, and each one of us here today. That's very much important to do it in unity work, and together we can drive meaningful progress towards an AIDS-free future. So, home take messages take early, treat constantly, and follow up through the postmortem to protect both mother and child. Integrated stigma free. Stigma is very much important. Woman centered care is key to better outcome. Empowering the woman with the ART advance and prophylaxis awareness, strengthening the HIV infections, and elimination of mother to child transmission is achievable when every step from preconceptions to postmortem is supported without gaps. So, this is the very much important. Hope is stronger than the real knowledge. Knowledge is stronger than the stigma. Thank you. Thank you so much.
Uh, Thank you, Dr. Abhishek, for the insightful session on supporting women, especially throughout their journey from preconception and postpartum.
Thank you so much.
It is
Thank you.
appreciated. Thank you very much.
Thank you.
Yeah, thank you for all the active participants and for the speakers, those who have shared their knowledge.